A year after taking office as the state's top legal officer, Arizona Attorney General Kris Mayes continues to tackle Medicaid fraud. She's called it one of the largest scandals in the history of Arizona.
A scheme preying on people with addiction issues once they're enrolled in AHCCCCS, the state's Medicaid program, charging for services that are rarely provided. Fox 10 investigator Justin Lum went one-on-one with Mayes to see how much progress has been made.
Since Kris Mayes took over the Attorney General's office, there have been 44 indictments of those allegedly involved in behavioral health scams. But she tells me the fight against fraud is far from over.
We've got a long way to go, but AHCCCCS has made progress, and my office continues to prosecute these cases to the fullest extent of the law.
Arizona's Medicaid agency, AHCCCCS, has already suspended payments to more than 300 behavioral health providers accused of defrauding the state for nearly $1 billion.
And I personally believe that the number will top $1 billion before it's all said and done.
Arizona AG Kris Mayes says money is clearly the motive in the sober living scheme. New suspension notices obtained by Fox 10 reveal more detailed allegations like misdiagnosing patients for benefit of payment, providing payments for business, billing for incarcerated members, and billing under another national provider ID.
This is about turning the spigot off, because these criminals know that there's a honeypot at AHCCCCS that they can go to, a Medicaid honeypot in Arizona.
By targeting vulnerable people fighting addictions, mainly recruiting Native Americans off tribal reservations to sign up for the American Indian Health Plan under AHCCCCS. Last December, we saw several more suspects charged with patient brokering, accused of negotiating lucrative deals with undercover agents to send 75 patients to a fake rehab center, costing $300 per person per day. Our reporting showed how victims are enticed with alcohol, drugs, and money. I asked if this scheme is linked to organized crime out of the country.
We are aware of national and international criminal connections.
AHCCCCS has told Fox 10 it continues to overhaul its systems to recognize red flags and fraud. Mayes says more can be done.
We could be using AI to identify fraud, to identify patterns of billing and fraudulent billing, and that can't happen when you're operating on a system that was developed in the 1980s.
Also recommending that behavioral health billers be monitored. So you think that we're just scratching the surface as far as reform, even with more than 300 suspensions?
We've got more than 250 ongoing cases right now in my office alone. And we are doing by far the most prosecutions in the state. But yes, I believe we are just scratching the surface when it comes to reform. We're making some progress, but we need to make more progress, and we need to do it faster.
The 6-month extended moratorium on new behavioral health provider enrollment ends in June. AG Mayes believes that bad actors are just waiting for enrollment to open up again. She and her staff are working with other state Medicaid agencies to prevent the sober living scheme outside of Arizona. I'm Justin Lum for Fox 10 Investigates.